And welcome back to the Narwhog. This week, we're going to be talking about things we're afraid of with special guest, psychology teacher Janice Morey. And not just anything that we're afraid of, not those normal everyday fears, but those irrational fears that we call phobias. No, it's okay, it's dry. Ba-dum ba-dum, ba-dum ba-dum, ba-dum 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 ba-dum. The Narwhog! Well, here we are in the Narwhog, and I have with me Janice Morey, our psychology teacher, and she's here with us to talk about the psychology of phobias. What is a phobia?
But a lot of times they're just irrational fears, and if we can ever face them, and there's a lot of different ways that you can do that, then you should be able to overcome them.
Are there good treatments out for phobias generally?
Not for the person who has the phobia, I don't believe, because a lot of times it's just exposure to whatever
to realize
the
that
item.
This is irrational.
And so a lot of times there's different treatments. Exposure treatment is just the first one, and you just try to, if, for instance, if it was a coffee mug, you would start with the coffee mug at a place at which the anxiety is not too much.
Right.
You go from a systematic desensitization, where you just do some relaxation techniques up until you feel a point that you can handle it. And so it's really just a process.
Sure. Would you think that there is a time when a phobia is not necessarily, or there's no point in treating a phobia, perhaps? Are there mild phobias that don't really...
Okay, another thing about phobias is the question is, does it interrupt your daily routine?
Right.
And so if it doesn't interrupt your daily routine, then yeah, there's not really any reason to have to face it too much.
Sure.
As long as you don't go into an anxiety attack if it were to be around. If you were able to pretty much keep your distance from it and continue with your daily routine, then not a whole lot of reason to increase the anxiety to try to face that.
Right.
So
is increasing the anxiety to overcome it worth the
Right.
anxiety you'll endure while doing so?
Exactly.
Makes sense.
So that would be the big way out. It's always a balancing act a lot of times with phobias. But if it is disrupting your routine, daily routine or whatever, from time to time, if it's having enough of an effect, then we need to face the phobia.
Sure. Where do phobias come from anyway? Do they always have an identifiable source, or are they sometimes just things that happen?
Many times we have been conditioned. Many times if you have a phobia of heights, your fear of heights or something like that, it may come down to a rational aspect that your parents really emphasized in raising you. Is, don't do that, you may fall, don't do this, those type things. So sometimes and many times we are conditioned. Or for me, I don't like spiders and I don't like snakes, but I question whether or not that comes directly from me or if that comes from my father.
Sure.
My father cannot stand snakes. He will run like a little bitty boy, and he is a huge man, so it's pretty funny. But anyway, so I'm curious if I have not been conditioned to not like.
Sure. So we've observed in others, particularly our parents and our caregivers. Interesting. Very interesting. Well, I have a phobia of wet wood.
Which is
It's very specific and very unique. If I touch a piece of raw wood that is moist, it gives me the chills and shivers. I call it the gibblies.
The gibblies, yes.
And even thinking about it sometimes can trigger a reaction. So it's pretty severe.
Any idea where that started? Do you remember a time where it started?
I analyzed it, and it gives me the chills just thinking about it. It comes originally from, I believe, when I was a child and I was eating popsicles.
Ooh,
and I was chewing on the popsicle stick, and I got
splinters
in my tongue.
Ooh.
And I had to remove the splinters out of my tongue, and ever since then, popsicle sticks are by far the worst.
Oh.
But any wet, raw, rough kind of wood. Where it usually gets me is washing dishes.
Okay.
Wet wooden spoons.
Ooh.
Absolutely kills me.
Not okay with the wet wooden.
No. So if I have to wash dishes, or if I wash dishes for my wife or something like that, I always have to pause and say, "Will you please do the spoons for me?" So
very nice.
Anything with a wooden handle.
But now you do know that you are very capable of overcoming this.
is it worth the anxiety? Yeah, this isn't something that interferes with my life so much.
That is true. See, this is a perfect example of it's very seldom that those things happen, so maybe it's not worth it. But now for your wife, it could be worth it.
Yeah. No, I do the rest of it and just leave a sink full of wooden spoons and try not to look at them too much. But another question I had for you, I noticed that after, I'm pretty sure I've identified this as a wet wood thing, but it's kind of broadened out beyond that for me in some ways to paper products to some extent. Cardboard, for instance, damp cardboard really bothers me. And so, if you have a box that's been like folded up together and you pull it apart, if it's slightly damp and I hear that rubbing together, that gives me chills. It's kind of like, I guess, the scraping on the chalkboard thing. That doesn't bother me, but the wet cardboard rubbing.
Yes. Okay. Well, so my opinion of that would be, and I'm definitely not a professional, but my opinion of that would be, you're a very educated man. You know that product comes from wood, typically, and so I think you're just associating.
So it's a completely internal thing. It's not the physical substance. It's my brain telling me this.
I would think it would be knowing you and how analytical you are, and knowing that one thing can connect to another.
That's true.
You probably are connecting
associating. What are some of the most unique phobias that you've heard of or experienced?
Probably one of the most interesting one was, I thought it was a joke, which I feel very bad about that, but a student explained to me that he was had a fear of lead, and so I thought, ha, you're just trying to get out of your work, but come to find out, no, he really did. And so unfortunately some people thought pencil lead, yes. So he always had pens to write with. He did not have a phobia, so he wasn't trying to get out of any work, is what I found out. But he did not like pencil lead. He did not like pencils around him. He would become very uneasy. Like sometimes we take a Scantron, and so you have to take it on pencil. I had to make an exception for him, but at first, when he did try, at first his anxiety level watching that was
and that added to test anxiety. I'm sure could be very difficult to overcome.
So we definitely forgot about that part and allowed him to take his with the pen. So
you certainly wouldn't want to hamper someone's educational process.
No, not at all. So when they're realistic, you absolutely want to work with people. But unfortunately, a lot of times we joke about a lot of the phobias when they can be very much real, and they can definitely interfere with everyday life. And so you want to help the people that have those phobias continue on with a normal everyday life. And so if you can make adjustments to that, why not?
Yeah, absolutely. Absolutely.
But I mean, some of the common ones, agoraphobia, I mean, I cannot even imagine. I can't imagine being those people that get so scared of open spaces that they stay in their home 24/7, never leave. That one, that would
be very sad.
Yes. And it's happened to many. There's lots of cases out there where it's happened to many intellectual, wonderful people, and they cut off the world because they cannot overcome that phobia.
There's an interesting study that agoraphobia spiked after World War II for women because of that whole get back in the home thing. We loved Rosie the Riveter when we needed her, but now you need to get back in the home. And that whole idea of, that societal message telling you need to be in the home, you need to be in the home, you need to be in the home. All right, fine, I'll never leave ever again.
Exactly. Don't even ask me to. So yes.
Absolutely. So very interesting.
But some of the treatments are, of course, interesting in the aspect that you have to keep that balance of the anxiety levels. And so therefore, especially one that everybody really doesn't like, but it really is probably the quickest, is just flooding. You flood them with whatever it is that they're having the irrational fear about. And over time, they may panic for a period of time, and you never know how long that period of time is, but over time they'll realize that it's sitting right here beside of me and nothing terrible has happened eventually. So, but
I still don't want to pick up a wet wooden spoon and told it into her.
I think he can do it. I think he can do it. But and then some other more simple ones would be just modeling. A lot of times getting other people, getting other people.
It's okay, I'm doing it.
Yes.
I'm petting the spider. I'm leaning over the precipice. No.
No.
I'm stepping out my door.
Oh yes, now that one. I of course show an interesting one, a video in class that shows the individual having such a hard time, literally taking the foot out of the doorway, trying to overcome that, and they're like, just step, you know. But it's not that easy for those that have the phobias.
Sure, it's interesting how some phobias are extensions of rational fears. I mean, we're afraid of spiders, we're afraid of snakes because sometimes spiders and snakes are actually dangerous.
Exactly.
And actually could poison us.
Yes.
Although that's actually, pretty rare. Same thing with heights. Leaning over a cliff is a dangerous thing to do. You could fall and definitely get hurt. And so it's an extension of a rational thing, but it's the point where it hampers your existence.
Yes, but I've also heard bananas.
Sure.
I've heard many things, like I said, with the lead.
I've actually heard of banana too.
Yes. So there are definitely many that have very rational origins, but then for whoever has the phobia, they're all rational ideas.
Well, thank you so very much. I really appreciate all of your help with this topic and your comments on this topic. It's a fascinating topic.
It is.
And now I think I will just continue in my happy life of not touching wet wooden spoons.
I think we all need to encourage him to overcome this fear. He can do it.
No, it's not going to happen. Anyway, thank you so very much.
You're welcome.
Glad to have you on the Narwhog.
Anytime.
Thanks for watching. Click on the snake to watch the previous episode, or click on the scary spider to watch the next episode next week, or click on the wet wooden spoon to subscribe. I'll see you next time. Boo. Ah! Yikes.